Welcome, everyone, to your telesummit. Your wait is over. Postmenopausal Women Scaling Back is the name of the summit. And I'm your host, Jean Nitray, weight loss expert. And this series of conversations is to empower you to manage your excess weight. I imagine that's why you're here. And focus on postmenopausal women with practical tips and information that allow you to lose the weight and get your vitality back. So my guest today is Dr. Shiroko, and she is a MD and an acupuncturist and has been in this practice for over 25 years. Thank you for being here, Doctor.
Thank you for having me. I'm so happy to be here.
Absolutely. And her mission is to support people in feeling good. And we all want to feel, most of us want to feel better. Well, I guess that's kind of an assumption we can make in these days. So would you tell us a little bit about how you bridge the Chinese medicine and the Western medicine, and maybe how they complement each other and that kind of thing?
Sure. So the idea in Chinese medicine is that you are made up of energy, and energy travels through your body in certain patterns. It travels up and down and around and all over the place. And when your energy is out of balance, there are problems. And so the whole purpose of Chinese medicine is to balance energy so that your body can do what it needs to do naturally. Mm-hmm. And the idea is that all of our cells remember how to be healthy. And so all we have to do is remind them. Mm-hmm. And, you know, originally I trained in Western medicine and I trained in general surgery as my residency. And at some point I realized that I wanted to save lives in a different way. And in surgery, you're saving lives, you know, like in the moment. And it's very, very intense. But what I realized is that once your life has been saved, what next? You know, and so I started searching for other things. And one of the things that really bothers me is how much pain that people are in physically, a lot. And especially after surgery, there was so much pain, and the medications didn't really work. So I was looking for something that would allow me to help people with pain in a different way. So I found this book on Chinese medicine called The Web That Has No Weaver. And what's that?
I've read that one, yes.
Yes, it's a wonderful book. And I fell in love. I fell in love with Chinese medicine. I fell in love with the concept. Mm-hmm. And what happened is, because I was fairly young when I started sort of shifting my awareness to Chinese medicine, is that both Chinese and Western medicine became sort of mixed for me, you know. So because I went to work in the emergency room and went to acupuncture school at the same time. And so I would be studying about how to read pulses and how organs work in Chinese medicine, and then I'd see a patient in the emergency room and it would fit what was going on with them. And so for me, what Chinese medicine is, this like big picture. It involves your emotions and your spirit and how your energy moves, and how the organs work is different than how they work in Western medicine. But in Western medicine, especially now with a more functional medicine approach, you can go so if something's out of balance here in the Chinese medicine world, I can use Western medicine and kind of fit it into the place where it belongs. Mm-hmm. Mm-hmm. How I use both of them is really to get you in balance. And how I'll see a person and I'll see what their imbalance is from the Chinese medicine point of view. And then I'll use Western medicine to study that more deeply. So for example, in Chinese medicine, the kidneys rule your low back and your knees and your bones and your overall sense of having energy and big transitions in life and your hearing. And so if you translate big transitions in life and overall sense of having energy into Western medicine, that would be hormones.
Yes.
And then the physical matter of your brain, that would be your brain chemistry. And so a woman in menopause is very likely to start having lower kidney energy. It's one of the reasons that things start to go out of balance as you get older, is that your kidney energy starts to shift and you get lower and lower in energy, meaning hormones. And then that causes your digestion not to function so well. And so that leads into the possible weight gain that it's hard to get rid of because you don't have enough juice, really.
Mm-hmm.
So when somebody has that sort of scenario, what I'll do is I'll measure their hormones, their adrenal hormones, and see, where are they, and then help them get that in balance. And I could use acupuncture or herbs or even bioidentical hormones to help them get their hormones in balance, which would then help them have more kidney energy. And then they would sleep better and feel better and possibly lose weight more easily. So that's one scenario.
Mm-hmm. Well, what really piqued my interest there is when you said that you do work with bioidentical hormones. I'd like to know more about that. Would you more or less do that or prescribe that for any woman who wants to lose weight, or?
Depends. Everybody's so different, and that's part of why I do what I do, is that I could have 5 women who have the same symptoms and they all have a different treatment, or they have a different protocol that will work for them. One woman may need herbs. One woman may have some digestive infections that I have to treat first. Mm-hmm. And one may need a certain kind of hormone and another one may need other hormones, So let me start by defining bioidentical hormones, in case that hasn't been done already. Bioidentical hormones are hormones that are exactly the same as the hormones that your body naturally makes. So when you're a cycling woman before menopause, you're making certain kinds of estrogen, you're making certain kinds of progesterone and testosterone. And if I were to give you hormones, I would give you the same ones that your body would naturally have, not something artificial. It is, however, made in a lab. So if you see, somebody says that you could take Premarin, which is quote unquote natural, Premarin is made from horse urine. So it is natural, but it is not bioidentical. It is not the same as what your body naturally makes. So you want to have, if you're going to take hormones, you want to have the kind that are the same as what your body naturally makes. And, what's that?
Even though they're synthetic, they can get them close enough to the...
They're exactly the same as our body's chemistry. Yeah.
Which makes them safer.
And then, what's that?
Which makes them safer as well, because the...
Exactly. Yeah. Okay. So, and there's now testing available. I do a urine test. It's called a Dutch test. And it's dried urine something. And it measures not just what your hormone levels are, but it also measures how your body uses them, which is really super cool, because a lot of people are afraid to take estrogen now because there are certain patterns of estrogen, the way that our bodies use estrogen, that can be converted into dangerous estrogens that can cause cancer. Mm-hmm. But you can actually see that tendency by doing this urine test. You can see whether a person has the tendency to make those kinds of estrogens, and you can very gently nudge them in the right direction so that you don't make that kind of estrogen.
Wow.
Yeah. And you can also see, cortisol levels have a lot to do with weight after menopause. And a lot of times what happens is that the sex hormones go down and the cortisol levels go up. And so the stress hormone is higher, and then the hormones that help you lose weight go down. And so you want to balance all that.
Right.
So
you're talking about insulin and leptin balancing those hormones, or not so much? It's like...
I measure all of that, and those are more modifiable with diet, whereas cortisol is not necessarily modifiable with diet, although it can be a little bit depending on when you eat.
Exactly, depending on when we eat. And what I've been doing with myself and clients is, well, at least for myself, I can speak for myself, is just eating within an 8-hour window. And that, I think, is the one thing that has really helped my waistline to get smaller and the adipose fat to reduce. Is that what you're talking about in terms of timing?
Well, that is one thing that it's kind of new science, really, is to do some of this intermittent fasting is what you're talking about, right? Where you don't eat between 6 p.m. and maybe 8 a.m. the next day, right? And I have found that to make a huge difference, really relatively recently, and I like it a lot. And it also helps with blood sugar, which is really the thing that probably causes the most issues for weight in terms of as we're getting older, is that we become more and more resistant to insulin.
Yes.
which you can actually also see on that hormone test that I do, the Dutch test. You can see whether a person has a tendency to become more insulin resistant and how they process their hormones. Yeah. And how they use their cortisol, and even how you process testosterone in your body. You can see whether you're more prone to insulin resistance. And the intermittent fasting will make a difference.
It's so great that you can get very specific and these minutiae
Yes.
that make
it's really cool. I love it. Yeah.
Awesome.
Yeah. So yes. And so one thing that makes a difference is the intermittent fasting. But the other thing is making sure that the first meal of the day is really high protein. And if you're a person who wakes up with high cortisol, if you have a high cortisol level in the night, or you're having trouble sleeping because you have a high cortisol level, then first thing in the morning, within an hour of getting up, you have to eat a high protein breakfast. And that will be, what's that?
Within the first hour of waking, you need a high protein breakfast?
Mm-hmm. If you have a high cortisol in the nighttime, then that begins to reset within a week, you can reset your cortisol levels just by doing that.
Wow, within a week.
Yeah.
And so you're looking at these different indicators and levels, like we were just referencing a minute ago. Do you work long distance with people? Because
I do.
California, I think.
Yeah, I'm in California. I'm in Northern California. I do work long distance, but in order for me to be your doctor, you have to actually physically see me once in a year.
I see.
Yeah. So if you need prescriptions and things like that, you have to physically come and see me. I've tried to do it at a long distance with people, but I can't actually prescribe a medication to somebody unless they have come to see me in person. So I can counsel, I can coach, I can tell you how to do things, but I can't prescribe unless you come in person at least once in a year. It's only once in a year that you have to do it, but yeah.
And so during and after menopause, I think you said that, the energy flowing in our pelvic area is not doing as well as it could be in terms of energy flow. Is there anything or more than one thing that women can do to help that? Like maybe some pelvic exercises or something?
Sure.
Breathing.
Yeah. Anything. So there's a lot of things you can do to strengthen your body in every possible way. I have so many tips. I mean, I could just go on and on and on, but Kegels are one way of strengthening your pelvic floor, right? Pilates is another way of strengthening your pelvic floor and building your strength. And one of the things that happens as we get older is that we may become more sensitive to injury. So hardcore exercise is not necessarily the best for us. It's better to do Pilates or yoga, and you need strength. So you need to build your strength, but you need to do it in a different way. The hardcore punching bags and kickboxing and things like that, they're not necessarily good for us. Now, and again, everybody's different. This is where listening to your body comes in. You have to learn to listen to your body. But a lot of people come to me and say, it's much more easy for me to get injured now. And
or break a bone, or
whatever. Well, hopefully you're healthy enough that you don't break bones. So but it's easy to injure your ligaments and tendons because the strength of the muscle. So every muscle group or every joint is moved by certain muscles. So for example, here's my shoulder, right? So there's 6 different muscles that move my shoulder. And as we get older, they're much more sensitive to the imbalances of movement. So let's say we're always sitting there hunched over a computer or something like that, right? Well, then that pulls the muscles in a certain direction, and you're much more sensitive to them not pulling evenly. This is purely mechanical. This is if you don't strengthen these muscles in the same way that you strengthen these muscles, then you're not going to be in balance. And so you have to do exercises. I tell men this too. You have to do exercises that keep your body in balanced strength. And the older we get, the more sensitive we are to that balance. So actually, I think as we get older, exercise is even more important than when we're younger.
Yeah, to promote good balance and stability and flexibility, right?
Mm-hmm.
Because
Yeah.
flexibility is a main.
Use it or you lose it.
Right.
Yeah.
Whole body, pretty much. Now,
Yeah.
I'm a big fan of turning on the lymph system, which takes away the toxins.
Mm-hmm.
And I know we didn't talk about this beforehand, Dr. Shiroko,
Mm-hmm.
but is there something you can say about the lymph system turning on and, moving our limbs and at least walking?
Sure.
Pumped up.
Yeah. Well, I mean, first of all, the way I approach healing is that I look at it as a triangle.
Mm-hmm.
So I take all that Chinese medicine and I take all that Western medicine, I put them together as one sort of thing that's I call it the triangle of wellness. And hormones, immune system, and nervous system are the components.
Mm-hmm.
And the immune system is the lymph system, right? So and as all of these things, if all three of these things are in balance, then your body can function. Then it has the tools. And no matter, when I say people to feel well, no matter what, I work on getting this thing in balance. No matter what diagnosis you have, if you start to get more balanced hormones, more balanced nervous system, more balanced immune system, then you'll feel better and you'll be able to heal from anything. It's kind of like giving your body the toolbox that it needs in order to create the healing that it wants to do. So your lymph system runs your whole entire immune system, right? So that's where your immune system gets balanced. So detoxification fits into sort of getting your immune system tuned up. So certain kinds of movements like rebounding. Have you ever used a rebounder?
I have.
So rebounding is good for that, or walking outside and just moving your arms and legs. Any kind of movement will get that sort of thing going. And then you want to make sure that you eat the right foods to help support your immune system too, and you don't want to eat foods that your body doesn't like, because the more you do that, the more angry your immune system gets.
Mm-hmm.
And then the more you build up toxins, and that can be another way that you can have trouble with weight gain or weight loss.
So what are some of the foods that we can eat that are typically known to strengthen our immunity and the detoxing effect, first of all?
Well, greens.
Yes.
Greens are the best thing for detox. So everybody should eat tons and tons and tons of greens every day. Now, in Chinese medicine, raw foods are not necessarily considered to be healthy for everybody.
Mm-hmm.
So a lot of people think that they should eat only raw foods and that's better for weight loss. But a lot of people have a weak digestion. And so cooked foods are more recommended, actually, if you have a weak digestion. And if you are a person who has a tendency to get bloated or to have problems with your digestion and you don't quite know why, and you tend to eat a lot of salads, try cutting out salads and eating your vegetables cooked. And you may find that all of that goes away. I've seen that hundreds of times, that people don't really understand why they have so much bloating. And it may not be gluten or dairy that's causing it. It could be eating too much raw food.
Mm-hmm.
For someone who has a weak digestion.
Yes. And so if people cook their vegetables, just like steam them or something like that.
Or stir fry them.
Right.
And again, it's one of the things I look at when I'm diagnosing. I feel your pulse and I look at your tongue, and you can do this yourself. I'm not going to show you my tongue, but if you look at your tongue in the mirror and you see that it's swollen, and if you have, like, it's big and pink and puffy and it has on the edges there are like scallops, mm-hmm. that means that your body is holding too much cold dampness. And so one of the things that's worth trying if you have a tongue that looks like that is cutting out raw foods. Mm. There's many other, so many things that you could do, but that's one of them, is like just cutting out raw foods and seeing how that works. Mm-hmm. Of course, there's the whole eating according to the seasons too, that the Chinese believe in, so like in summer when it's hot, raw foods are better, but in winter, almost never. You should almost never eat raw foods unless you live in the tropics where winter is hot, so.
Right, because winter is cold or cool, and so our raw foods that you can just tell they're cool.
Yeah. And they'll make you feel bloated and gassy and damp. And everybody thinks, oh my God, I'm eating so healthy, but I don't feel good. Well, it can be that simple, because what's healthy for one person may not be what's healthy for someone else,
Exactly.
So, yeah, having just had a salad for lunch.
Yeah, so did I.
But, so what was I saying? I was saying something about, what to eat. Greens. So lots and lots of greens, chard, spinach, asparagus. Asparagus in Chinese medicine is really good for the liver. It helps the liver cleanse. Broccoli, cauliflower, Brussels sprouts, all of those, if you tolerate sulfur. So some people don't tolerate sulfur well. And again, this is why everything's so individual, so like you can actually learn through your genetics whether you do well with sulfur, unless you're a person like, if you're a person who tends to get headaches when you drink wine, you might have a problem with sulfur. Or if you're allergic to the sulfa antibiotic, you might have a problem with sulfur. And so if you have that problem, then eating too much broccoli or cauliflower might not be good for you.
Right, exactly. So what about the time of day when it comes to cleansing with greens or whatever we're going to use? Is there a better time than another?
Well, time of year. So I only recommend cleansing in fall or in spring. In winter, our bodies are going inward. Our energy is lower, if you notice. And especially after menopause, again, the time of year that the kidneys are rule your body is in winter. And the kidneys are, they're the time of restoration. So you don't want to be cleansing in winter. A lot of people do their, annual cleanse in January. It's not a good time.
No.
Yeah, and especially if you're trying to eat raw foods or juice or eat a lot of greens, it's not good. In springtime, however, that's when the sap is starting to flow in the trees, but it's also flowing in your bodies. The energy is starting to flow and energy is starting to move. And the springtime is the time of the year of the liver. And so it's the best time to cleanse is in, any time between March and June is a good time to do a cleanse, because that's when things are starting to flow, and it's a great time to sort of do a lot of elimination and things like that. Right. And then in terms of times of day, I think times of day more matter about balance. So like we were talking about having the intermittent fasting. So you don't want to eat at between a certain time of night until the following morning. And you want to make sure you have enough protein at breakfast time so that you have enough fuel to get your day started. And that's also important in relation to weight loss. You want to have a higher protein meal at breakfast. And then, so you want to be heavier. You can have greens any time of day, So if you're just doing greens as your cleansing thing, then you want to have 80% vegetables in your diet. If you're trying to cleanse or if you're trying to lose weight, you want to have a lot of vegetables. Then you can have that all during the day.
Sure. Okay.
So
if someone, likes Chinese medicine, but they don't know much about it, and they're experiencing some symptoms of menopause, and they went to the Natural Grocers health food store that I love, and the very knowledgeable and trained people there, and said, hey, what have you got in Chinese herbs that could help with this particular symptom? Would you recommend they do that or not? Or could that be? I
always start from the ground up. So I want to talk, I start with nourishment. So food. Start first with the foods. And here's an example. Like if you have a lot of hot flashes, one thing that can help lower your hot flashes is blueberries. One of my patients actually years ago, she managed most of her menopausal symptoms by eating blueberries. Wow. A cup of blueberries at night. And so because the hot flashes are worse at night, so she would have a cup of blueberries before bed. And they're very low in calories, and they're really good for you as far as antioxidants, but they're also cooling from the Chinese medicine perspective. So there's foods that are cooling that will help you with the hot flashes, or there's foods that are warming that will help you feel warmer if you tend to feel cold or you have thyroid issues. So first of all, I start with food. Then I start with the basic nutrients, you know, so like if you need a multivitamin, omegas and vitamin D, omegas themselves can change the menopausal symptoms because omegas will help balance your hormones.
Mm-hmm.
So if you get the right kind of omegas and enough of them, then you could get enough just from that.
Mm-hmm.
So, you know, we're progressing, right? And then you come to herbs. So then there's the whole spectrum of herbs, and there's millions of herbs, right? Millions. And in Chinese medicine, there are hundreds of formulas. So yeah, you could go to a health food store and you can ask the person there and say, well, what would you recommend? Maca is a great herb for balancing estrogen. So that's an herb you could start with. You know, it's a safe herb to take for most people unless they're allergic to it, which very few are. And it's there's certain herbs in Chinese medicine that are called emperor herbs. I call them emperor herbs because they'll do anything and they're psychic. Or you could also, you know, translate that into, they're called adaptogens. So they're the herbs that adapt to your body's needs. So maca is one. Holy basil, rhodiola, ginseng, those are all herbs that are called adaptogens, and they help your body adapt. Now, I have categorized them through my many years of experience for different things that they do better. Mm-hmm. So, but maca is a safe thing to take. It's going to help balance your hormones. It'll help estrogen and progesterone and testosterone. And you can see how it works. There's another herb that's very popular to give that you might be told in a health food store that has, it's not Chinese, it's black cohosh.
Black cohosh.
And black cohosh, that is good for hot flashes, right? But I don't think it's effective for everybody. Well, nothing's effective for everybody, but also it's not an adaptogen. So it will have a limited frame of use. So you can use it for a short period of time and then you may not be able to keep using it. So something like maca is a bigger herb that can cover more bases and would be considered more safe. And then the way Chinese herbal medicine works is that usually they don't give herbs in isolation. They don't give one herb because there's this whole way that they complement one another. You know, so like one herb will do something that another herb won't do, and then when together they'll work even better than one. And so that's how there's a lot of formulas. And they all have different names. So you would have to probably go to somebody who knows what they're doing to get a formula.
Sure.
To help balance. Yeah.
Well, of course. Yeah. Yes.
So.
All right. Well, we're coming toward the close, Dr. Shiroko, and I understand that you, as well as my other speakers, have a free gift. And would you like to tell us what that is?
Sure. I have a little booklet called Supplement Smart. And it tells you how to choose supplements. And so so especially if you're going to go to the health food store and buy supplements, you want to know what the ingredients are that you could get and how to choose them. And so I wrote a little booklet on how to do that. That's on my webpage at hearttoheartmedicalcenter.com.
Oh, that's wonderful.
So,
cool.
Yeah.
All right. Well, thank you so much for spending your time and your expertise with us. I'm sure this has been of value. It has for me, at least. And so I'm going to sign off now to my audience and look in your mailbox, your inbox tomorrow for a couple of other videos. And we'll be seeing you on the Telesummit. Bye for now.